This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us today on Columbus Concerns. The governor made an important announcement this week as the coronavirus pandemic continues. He talked about opening up parts of Ohio's economy. The governor said that barbershops and hair salons can reopen on May 15th. Restaurants can start offering outdoor dining on the 15th with indoor service beginning May 21st. So we're going to hear from several people this morning on Columbus Concerns. First, Treva Brewer, who is head of the Working Committee on Restaurants, which made their recommendations to the governor on when to reopen, and Debbie Penzone, who also covered the personal services industries like spas, hair salons, and barbershops, and the governor himself with some observations on how Ohio will reopen and what exactly will happen. So we're going to hear from Treva Brewer, Debbie Penzone, and Governor DeWine this morning on Columbus Concerns.
How you doing?
Hi, fine, Governor. Thank you.
Thanks for joining us. You want to tell us a little bit about your group and kind of who you pulled together, and kind of what will be different when customers come in, and what maybe will be different for the employees and the folks who are in charge. Just kind of tell us how this will look a little different.
Absolutely. Thank you. It was certainly my pleasure to lead this talented group. As you said, we had a wide variety of folks on the team, and we also had representatives from the health department. And it was really an amazingly collaborative effort. And I felt like the differences, while on the surface could look like they could be challenging, they actually strengthened the recommendation that we put together for you. And it was certainly, like I said, my privilege to lead them. You asked if I could share a few examples of maybe what the customers will experience as we reopen Ohio, our bars and restaurants. Let's start with space. So restaurants and bars are going to be asked to create a floor plan that it complies with current social distancing guidelines. For example, under the current mandate, there are parties of 10 or less that would be seated together, and then each party is then going to be separated by either 6 feet or a physical barrier. So rather than having a hard and fast percentage like some states are doing, our advisory board actually focused on safety, not necessarily a specific number. So what do we mean by physical barrier? That could be fine dining, for example. You could have a high booth back that's almost like a wall. Or in some locations, they're using plexiglass that's being installed to separate. So we wanted to give each owner an opportunity to comply with those constraints within their unique space. What about waiting areas? You might be asked to wait in your car for either seating or maybe food pickup, or there might be a designated area now for queuing. And we would ask customers to just comply with those guidelines and be sensitive to those guidelines. A buffet bar or a salad bar will now be served to you rather than self-service. And there'll also be some 6 feet guidelines that are placed in those queuing lines as well. Entryways, for example, customers are going to see at the entryway when they come in, there's going to be a list of COVID-19 symptoms, and we're asking the public to self-monitor and ensure compliance before they come in. Employees was also one of the areas that we tackled. And so as you're entering and experiencing these restaurants, understand that while employees will be required to wear masks in certain positions, there are exemptions that will, for the restaurant industry, mostly apply to back of house. But if you see employees not wearing masks, understand these are for safety risks. One simple example is you don't want someone standing over a hot grill wearing a mask. So just understand that these restaurants are complying, but there are some exceptions that will be listed. And you, as a customer, as a guest, you might be asked to wear a mask. That's going to be at the discretion of the owners, and we would ask that you would respect those decisions. Another thing that you might see are gloves. This is an interesting topic. I know the gloves, it kind of makes everybody feel like Superman. They can touch anything, and it gives this false sense of protection. And I know the viewing public sees that, and there's a lot of concern around it. But there are very clear guidelines in food safety code that already exist today. And we as a team are returning. Our recommendation is to return to those guidelines. In many cases, we all ask our staff, put gloves on everybody, even though we know that's not necessarily best practice. hand washing is and will continue to be the gold standard, and therefore our committee is recommending that we follow those guidelines. So you are likely not going to see gloves on your cashiers or on your servers. One other area, Governor, that when we talked about this idea of open congregate space. So open congregate area will remain closed during this first phase, and we'll monitor our compliance as we go through this. But you could certainly repurpose that. So if you have a dance floor or other activity space, you can use that to be able to maintain that 6-foot distance of your tables. So that's why we didn't want to put a 50% of fire code compliance in place, because you might be able to keep all of your tables because of some of this open area and still maintain social distancing guidelines. So that's an example of how you could use that space. But I know we can do this. As you said, we can do two things at once. And I know we can do this. We can focus on safety and getting our restaurants reopened. So let's work through this together. We're asking everyone to don your masks. Please be respectful of the associates. They are doing the best they can. We're Buckeyes. I know we can do this, Ohio. Thank you, Governor, and I can certainly answer any questions that you might have.
Yeah, Treva, thank you very, very much. Thanks for chairing the group. You had quite a cross-section of Ohio on there. I don't know if you want to comment about that or how that impacted it. But
Yeah, we did. It was really amazing. We had, in fact, on Thursday night when I was given the list, I plotted it because I just wanted to know who the folks were that I was, being asked to lead. And I was really happy to see we had, a lot in Cleveland, Southern Ohio, Cincinnati, Dayton, Akron, and then we had some of the more rural areas, Columbus, and we had big brands, big national brands, and the public can certainly see that was a press release. So everyone that participated, you can find that press release with the full gamut of those that participated. We had fine dining, we had pizza, Italian, we had a yogurt stand, we had a tap room, quick serve, several of our national brands, family dining. So it was really a group that worked together, and then they self-identified. So we had the 3 groups: customers, employees, and space, and then they each got to identify which area they felt most compelled to help lead the discussion, and then it was done across teams. They worked very hard. In fact, one of our team members said it was one of the most intense projects he's ever worked on. So for all of those in the industry, I was certainly proud to lead this group. They worked very hard all weekend long to put the best recommendations forward. And Governor, we appreciated the guidance you gave us, which was you wanted to hear from us best practices, that you didn't plan to override our decisions. It was our decisions to bring forward to you those recommendations. And so we felt very empowered to do that.
thanks, Treva. One last question. Talk to us a moment about bars. Bars present a unique challenge. Depends on how the layout of the bar is. What did you all come up with specifically in regard to bars?
Yeah, thank you for that. So, there was one consideration, and I know many states have done this. In fact, I think most did. They separated bars and restaurants, and we chose not to do that. What we wanted to focus on was the physical space and the constraints to maintain social distancing guidelines. So, for example, if you're a bar with tables and with chairs, you can follow these guidelines. So why should you not be permitted to participate in phase 1, where, and it can't be about the alcohol because restaurants are serving alcohol. So we're not making a distinction between a bar and a restaurant. What we're making a distinction on is physical space. If you have tables and chairs and can comply with these guidelines, then you can participate. Really for that open congregate area, and we understand we would have loved to have been able to include everyone in this phase 1, but we needed to take it through these steps. And so that open space, if you want to put in picnic tables or folding tables, you can comply. But it really is about that physical space and being able to make sure that we can monitor and have kind of discrete floor plans. And that's just hard to do with open congregate area. I hope that answers your question.
Thank you very much. We appreciate it. Thanks to you and to everybody on the group. We're very, very grateful for what you've done.
Thank you, Governor.
Thank you. Thanks for joining us. We appreciate it.
Thank you.
You want to give us a little report how your group worked and what you came up with?
Yeah, Governor, I was very honored to be a chair of the Personal Service Committee and serve our great state, as well as I'm a licensed cosmetologist and hairstylist for 33 years. And our group of 30 in our committee was just amazing. It was very diverse. So we had the, one operator barber to the one operator stylist. We had the booth renting salons represented, as well as salons and spas of all sizes. We also had nail salons, tanning, and massage. And then we also had the 3 health commissioners that were on each and every call with us, guiding us with their knowledge. So I was very proud of us coming together as an industry and uniting because, just like the restaurants, there's so many different mom and pop shops or franchises or big salons, small salons. But we all do the same exact service when it comes down to it, when it boils down to that personal service. And that was at the core of our, working focus of our group, was really how to deliver that personal service from the client to the professional and the safest manner, and be able to be so inclusive of every type of business in our industry. So I was very proud of that, to work with them.
What's going to be different when someone goes in, has their hair done, goes to a barber shop? What are they going to feel different? I mean, what are they going to see differently, or what's going to be different, and what's going to be different from what the person who's serving them is doing?
Well, for the appointments, you might have to wait in your car until your appointment is ready. We'll also ask that the walk-in appointment or the appointment, that's the only person that enters into that facility, unless it is a child, of course, and the parent needs to come, or if they need a caregiver with them. And if they have a lobby or a waiting area, you're going to see the markings or social distancing there. You won't see the magazines or product testing or self-serve beverages out in the waiting areas. And, we'll be donning, our professionals will be donning the mask and really asking that the clients and customers come with their face covering or their mask, especially with our services being so personal and so close, delivering that service to that guest. And some facilities and some locations might have, it mandatory that you wear that mask or face covering when you get your service done. We'll be cleaning a lot in between each and every guest. So the sanitation right now, we are governed by the Ohio State Board of Cosmetology and Barbering Board. So we do a lot of sanitation and take a lot of classes and online education all the time. So of course, we're going to go above and beyond with that as well to keep everyone safe and make sure that we're ready for that customer.
Well, that's great. Thank you very, very much to you and for your group for doing this. We're very, very, very grateful. Appreciate it. Thanks for the good report.
Thank you. We're proud.
Just a few thoughts as we take a couple big steps today, or at least announce when we're going to take these steps as far as opening up the economy. This is a significant time in our journey, and just a few thoughts. One, this is a marathon. This is not a sprint. We're in this for the long haul, and I think we have to get our mind set that way. I never ran a marathon, but a number of our children have. Alice and Pat, Mark, son-in-law Bill, son-in-law Nick. I may have missed somebody in the family. Anna did a half marathon, but all our kids, all 8 kids were distance runners. And although my running career kind of ended in junior high, but in our family we're used to the long haul. We're used to the long distance. And I think really as Ohioans we've got to think about this way. This is not something that we're going to get through. We're going to run through this quickly. That's just much as we would like to. That's just not going to happen. Second, what we have to do to do these two things at once, keep us safe, get the economy back, is complicated. And what we have to do to fight back a bit against the virus is quite complex. The best practices in these businesses and these professions that we talked about today and all the other ones, that's very important. And that's important that everybody out there in business and profession follow what your peers have come up with as being the best practices so that we can ensure that our employees are safe and that we can ensure that customers are safe and that people have confidence that they can, in fact, go out. Next, there's still a lot we do not know about this virus. All you have to do is turn on the news, watch that, listen to that, read about it. This is constantly changing what we know. We know a lot more today than we knew before when it started, but we still have a lot to learn. 4, as we open up the economy, let me just state the obvious and not shy away from it. The risk is up. The more contacts that we have, the more that we do, the more risk there is. That we can expect. We are now, we think, at about a 1-to-1 ratio, which simply means that on an average, one person who is infected with the virus in Ohio infects one other person. If we could get below that, then you start moving downward. We can expect that the opening up of this economy is going to take those numbers higher. But what we have to do is do everything in our power not to let those go very, very high.
And Governor DeWine and the members of his committee on reopening Ohio's barbershops, hair salons, spas, and restaurants. I'm Mark Neuse. Thanks for joining us this morning.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
I'm Andrew Saul, Commissioner of Social Security. I'm here to warn you about telephone scammers pretending to be government employees. Some of these scammers may say threatening things like you will be arrested if you don't make payments or provide personal information. Do not fall for these tricks. These calls are not from us. Real Social Security employees will never threaten you for information or money. If you receive a call like this, hang up. Never give the caller your personal information, like your Social Security number or bank account, or send money in any form, cash, gift cards, wire transfers, or prepaid debit cards. Report the call to our law enforcement arm, the Office of the Inspector General, at oig.ssa.gov. Share this information with your friends and family.
Take a look under your bed. Find stuff under there? What about jobs? No? Now try your basement. There's a pair of overalls that overall you're not so into anymore. A perfectly good laptop that hasn't sat in your lap in months. And even more stuff, but still no jobs? Well, you really have both. See, stuff is defined as household articles considered as a group. Sometimes this stuff is no longer needed. Wait, no longer needed? That can't be right. Because remember those jobs you were looking for? Those are really needed, and they're the stuff inside your stuff. Even inside that winter coat that moved with you to Phoenix. Our job is to unlock those jobs, and it starts when you donate your stuff to your local Goodwill. Here's how we do it. When you donate to Goodwill, we sell your stuff to provide job training for people right here in your community. So just by teaming up with Goodwill, you help create jobs. And isn't that worth parting with the leftover keytar from your 80s cover band? Goodwill. Donate stuff, create jobs. Find your nearest donation center at goodwill.org. A message from Goodwill and the Ad Council.
Has your child swallowed your medicine, your laundry detergent, your nail polish remover? Call the Poison Helpline. Have you inhaled paint thinner, glue, pesticides? Call the Poison Helpline. Have a question about a dose, a fume, something your kid just drank? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first for fast, free advice from medical professionals. Call 1-800-222-1222 anytime, anywhere. 1-800-222-1222. Save the number, save a life. Brought to you by the U.S. Department of Health and Human Services.